Just like you may have heard, just like I also have heard, they say time waits for no man. When you set the clock, it keeps moving. There is just something you cannot reject. You can't change it. It keeps moving. And one of those things, you know, I know, is aging. You're born into the world, you just start growing. Before you know it, you hit year 1. Before you know you're at year 50, 80. But something happens. Some people are caught napping when they age. They get to 60, they realize they have achieved nothing. Some get to 70, they have achieved so much. How do you feel when you find an elderly person, a man, a woman, walking miserably on the street? Was there a plan for that person? That will be the focus on this segment of the program, and I believe you don't want to stray steps away. Aging, ageism. What is the position of aging in Nigeria? To sustain this conversation, I have somebody who talks aging, breathes aging, advocates aging in Africa and the world. She's been to the UN, ECOWAS, and the African Union talking aging. Dr. Emem Omokaro. Dr. Emem Omokaro is the Executive Director, Dave Omokaro Foundation, member Board of Trustees, Coalition of Societies for the Rights of Older Persons, co-founder and Secretary General, African Society for Aging Research and Development, President, Gerontology Association of Nigeria, GERAN, and a lot of other positions she has held, all tied around the platform of aging. Thanks for joining me on Insight.
It's good to be with you, Omini.
Okay.
To talk aging.
Well, I will not come from the place of what is aging. Where have we taken this campaign to in Nigeria?
Our campaign and advocacy is for a society for all ages. A society where investments in human development uses the life course approach, where access to health, where income security, where opportunities for learning, where continuing engagement, engaging your capabilities is a right for everybody, regardless of age. So what we fight for, first and foremost, is not to fight for a special position for older persons, but is to fight for the recognition of the same rights that person who is now old had across the life course. So if I had a right to access health as a child, if I had the right to access health as a youth, if I had a right for continuing engaging my capabilities, for being relevant as one in the working population, now that I'm old, why should my right be less? So the campaign is to say that every individual, every Nigerian, whether the person is in the womb, because once you're in the womb, life forms, is specifically a right holder. And where the government has obligations, the government has obligations across the age band. Okay. Yes, we recognize that there are challenges that comes with demographic trends, where you have unemployment, where you have adolescent pregnancies, so many things that challenge the government, that needs to be set right, that therefore influences the thrust of policy. But one thing to recognize about the beauty of a life course approach is that it gives opportunity for intergenerational synergies, so that whether you are advocating and investing in the child, there is somewhere there that the grandmother can fit in. Whether you're advocating for the youth, unemployment, there's somewhere there that the retirees, the professional was an engineer, an accountant who no longer is engaged, can come and mentor. So where you take a life course approach and you promote a society for all ages, everybody stands to gain. Okay. So where you ask the question, so where have we taken this campaign?
Because I asked this question, you've been there all the years, yes, and within Nigeria, yes, which is your focal country now.
Yes.
The question now, where are we with this campaign?
Where are we?
Yes.
Okay, you asked initially, where have you taken this campaign? First and foremost, we needed to sensitize. And how did we do that? We recognized every MDA that has the mandate on human development.
It cuts across all the MDAs?
It cuts across. Okay. Aging is a cross-cutting issue. So we have engaged stakeholders as far back as when we started with the Memorandum of Understanding with National Universities Commission. In collaboration with the National Universities Commission, we saw the need for gerontology education, to mainstream gerontology education in the Nigerian university system.
Is that
so we
already?
did that. Yes, some universities have picked up gerontology. So you can actually have a degree in gerontology. We have engaged the National Population Commission, the National Planning Commission, every MDA. In fact, we just finished a survey to see the extent of inclusion of older persons in development program. We just finished the survey. So we have engaged the older persons themselves, telling them that as right holders, they are the ones to advocate. And they are the ones to show their relevance. Okay. Because government or nobody should come from the standpoint of you're so vulnerable. It's not a welfare thing. It's not a pity. It's not. So we have engaged older persons. We have engaged CSOs to build capacity, make CSOs to be competent and coherent in what they're advocating. Because if you do not know the content, you cannot advocate. And we have engaged policy level officers. We have engaged private sector. In fact, across the board. We've been to African Regional Forum to fight for space in the engagement mechanisms.
We'll get to the African
of
Regional
sustainable
Forum.
development.
My target now is
and the UN
about policy. Yeah. Now, I know issues of aging are domiciled within the Ministry of Women Affairs and Social Development at the national level. Now, and aging is like, I remember years back, a pensioner led a group of pensioners to then NTA Calabar, where I was, and the message was to the general manager, if you don't get it right now, you will join us soon. And we're talking about aging now. You are within the policy platform to get an aging policy. You don't get it. But to catch up with us, where are we with the policy on aging in Nigeria now?
Oh, I would say that it took a while. As you know, 2003, there was a draft policy on aging that was anchored by the Minister of Health. 2008, the Federal Minister of Women Affairs is a ministry with oversight over the issues of older persons. They anchored another draft, 2008. So between 2008 and now, of course, those are moribund. So now, through advocacy campaigns, I think it has been revived. And I hear there's been budgetary allocation for us to go. But before then, the Emem Omokaro Foundation saw the need to train. Because what you don't know to do, you cannot do. When you don't understand the issues of aging, because people see the issues of aging from the traditional perspective, that it is family, it falls on family, it should be family. And then when they move to even accept government intervention, they see it as only issues of pensions. So it's about pensions, and therefore it's about the 4%, that worked in the public sector. And then when they now talk about issues of pension, they forget that there is the informal sector. When they talk about social protection, they forget older persons. And they forget the socio-economic implications, the health implications of aging. You understand? Non-communicable diseases, which afflicts more of older persons. They forget poverty in its multi-dimensions, which has to do with older persons. They even forget the skills, the talents, the wisdom of older persons, which can be exploited for development. Therefore, the issue of policy is the issue that cuts across. All the stakeholders must be engaged. So what we have done, and what I think the Ministry of Women Affairs now are about, is to list all the stakeholders that will be involved in the review, will be involved in the capacity, because we built capacity. We've trained 36 policy level personnel across the MDAs, and those ones are good to go because they know.
So are you saying they're properly mainstreamed now? To work together or synergize?
I think that is what the government should. I can't speak for Federal Ministry of Women Affairs,
okay.
But I think from our interaction, that is what they must pursue. Because when you talk about aging, there are the cross-cutting issues, intersections of aging, gender, and disability. So when you look at persons with disability, you have persons that are old at age. When you look at gender, we have older women. When you look at refugees, they are older refugees. Immigrants, migrants, they are older migrants. So there is no way you turn. So long as you're talking about people, you have issues of aging. And then, of course, to look at the industry perspective. How can we create employment? Okay. Very important. especially now that the government is about recovery of economy, with the national economic direction now is how do we recover? How do we create employment? How do we engage our youths? How do we utilize the resources that we have? My recommendation would be aging is a mega industry. If they could look at healthy aging, how do we get the population, the youths, the adolescents, to age healthily? That is an industry. How do we get care to older persons? The older ones with disability, the older ones with protracted illness, non-communicable illness. How do we get primary health care to get to the rural areas? And then for those ones who are bedfast, those ones who need long-term care, do we create a long-term care agenda that will build homes and centers that we can engage, train our youths in geriatric help? So if we take an industry perspective, what about products for older persons? What about even engaging the older persons themselves? So if we are looking to create employment, we can win both ways. Okay. We can take care of our older persons, we can create employment for
we'll come back to Nigeria. Let's talk briefly. I picked somewhere 2017 African Regional Forum, high-level political forum on sustainable and stakeholders engagement in aging. Mandate of open-ended working group on aging, implication of the 8th session and Nigeria. What is it all about?
You know,
has it held already?
Yeah, those have held.
Were you there?
Oh, yeah, of course. I had an opportunity to address the United Nations. Now, we go back to Sustainable Development Goals. Of course, you know that the Sustainable Development Goals is now the happening universal plan for development across the globe. You know, we had the Millennium Development Goals, but those goals were limited. And those goals, as a matter of fact, did not have stakeholders' engagement in its evolution. But the Sustainable Development Goals, you had all the stakeholders, all the CSOs, everybody was involved in coming out with these 17 solid goals. And the beauty of the Sustainable Development Goals, why I am excited, is that it's not a government agenda, it's everybody's agenda. So leave no one behind. And then it empowers you as an individual, empowers the CSOs in each country to not only hold government accountable, but to play their own role, to engage in the implementation processes. So it's not government doing it and ramming. It's not you going to the community and defining what should come to the community. It's you sensitizing the community to know that these are the goals. So what are their core deprivation? How do they want to engage and bring themselves out of poverty? And then government moving into build infrastructures. The private sector is concerned. Everybody is coming together, a broad range of stakeholders. That's the beauty of it. And then, of course, to make sure that the implementation processes are not derailed, the Sustainable Development Goals now at the UN identified 3 major platforms, levels. First, the national level, where you have all the players. You have government setting up the institutional structures, the engagement mechanisms, from the Office of the Presidency to the Office of the Special Assistant on Sustainable Development Goals, to the ministries, the sectors who are the implementers, and then down to the states, down to the local government, to the communities, and of course the CSOs, across the wide range, every thematic area you can think about. And then, of course, you have the African regional level. At the African regional level, that's where all the member states in the African Union come there to exchange ideas. It becomes a peer review. Okay. So you come, you volunteer, you want to show what you're doing, and then you come showcase what you're doing, and everybody hears you. And then at the end, they take a common position. Why do they take a common position? Because there are things that are peculiar to Africa, challenges that are poverty. How do we match economic growth with poverty? It's so slow, and it's almost never happening. And then, of course, population problem. Okay. Look at the magnitude, the huge youth population.
Yes, so we don't engage all the time.
Yes.
I think we have to cover good grounds within the time given us. Now, back home, how do we engage moving forward? After all this engagement, you have done so much interfacing with the government agencies, National Population Commission, Women Affairs Ministry, National Assembly, and you out there. I believe Nigeria was properly represented there.
Oh, yeah, at the UN, yes, Nigeria. But you see, you always come and review the reviewer.
Okay.
You always come, and I have had the opportunity to look at Nigeria's, because it was a national, it was a voluntary national review.
Okay.
So every country,
Okay.
44 countries this time.
Okay.
So I had the opportunity to sit down and listen to almost all the
talking
countries.
about to domesticate all this.
Yes.
Moving forward.
I think what I believe should happen is, first and foremost, Nigeria should ensure that everybody, every sector is at the table. Of course, you can't get them one-on-one, but their CSOs, for instance, at the UN, they have 9 major groups. At the African regional level, there are 9 major groups, but we advocated for the addition of other groups, otherwise you're leaving some people behind. Okay. You have, at the CSO level, you have women as a major group, youth, children. Now we advocated for persons with disability and aging, stakeholders on aging. You have farmers, now they're advocating for fishermen, environment, academia, people in research. So you can imagine how extensive. If Nigeria can truly, without cherry picking, bring all the groups so that nobody is left behind. That's number one. Get the engagement mechanism to be truly inclusive so that you hear the voices. They are the ones to define their core deprivation. If you're talking about poverty, you cannot know my poverty, what my core deprivation is, except you hear me. And then you cannot bring a program for me. So get the communities involved. Number two, get disaggregated data. We cannot shout enough about statistics. But unfortunately, the people who were left behind before, like persons with disability, older persons, gender, women, especially older women, especially women with disabilities, no data. Do we know how many women are pensioners? Do we know how many women? But the men are in control. The men are seem to be the ones, Okay. So if we can get reliable data that is disaggregated along age, gender, disability. Now, if we can go back and really look at our baseline studies and see how we derived our indicators. Yes. I'm talking to the National Bureau of Statistics now. If you look at the indicators that you have now, you see that some people are still left behind. Why is that so? That is so because hitherto, for instance, older persons, we don't have a policy on older persons. So there definitely would not be programs and activities and budget line really that reflects and can take on this. Now. No, we do not. Okay. We do not. So when you now say mainstream sustainable development goals into sector policies and programs. So where there was no sector policy and program, where are you mainstreaming it? Which means those people, if you go the way you were going before, are definitely going to be left behind. Okay,
before the director cuts us off, let me take off the news now. Now let's talk to Nigerians, yes. Beyond just government, which should drive the process. Yes. You have taken this so far, and the recognition is there now. What will you be telling to Nigerians to get involved in this crusade?
I want to say that if you notice, everything you talk about, you're talking about the future. Every plan you make is the future. Yeah. 2030 is talking about 2030, which means 13 years to come. And it is an irony that you talk about the future so much. Everything is about the future, yet you don't talk about aging. Future is aging. Aging is the future. So it is to put things in context, number one. One, the approach to development for everybody, approach to anything you do, look at the human right process, the benefits to everybody. You build a hospital in a community. How many people can access that service in terms of affordability, in terms of how appropriate it is? Do you understand? Yes. In terms of distance. So if you have that mind of leave no one behind every program that you bring, either to your community or to the state, that will help us to include everybody. And then we should have statistics in mind. But for us individuals, we should ensure that whatever we do, we think future and we think aging. Okay. And then healthy aging. The 3 priority areas of aging, according to the Madrid International Plan of Action, is number 1, aging and development. Integrate aging into development processes. That way you're better off. Number 2 is advancing into old age, advancing healthily into old age, health and old age. Always know, as an individual, that non-communicable aging is a driver of non-communicable diseases and a driver of poverty.
Okay.
So what are you doing to bridge the gap? What are you doing to stay healthy?
Okay.
So healthy aging, income security. That's
Thank
what
you
we
so
should
much,
think about.
Dr. Emem Omokaro. We have been talking aging, and you now know very well that aging has no limit. Aging cuts across. Every sector is involved. It's not only maybe the media that advocates it. You could also advocate aging. And we'll be talking with her, and I believe you've taken the message home, and maybe you could replicate it from here. We'll be talking with Dr. Emem Omokaro, the Executive Director, Dave Omokaro Foundation, and member Board of Trustees, Coalition of Societies for the Rights of Older Persons, co-founder and Secretary General, African Society for Aging Research and Development, and President, Gerontology Association of Nigeria. I believe you want to be a member of that association. I'm a member. Thanks for being on Inside with me.
Thank you very much.
And don't forget, aging, from what the resource person says, comes in bands. If you're 10-year-old, you're getting old. 20 years, name it. You are in that bracket. It cuts across. I believe you enjoyed the program. Be our guest always. And on behalf of all of us, bye-bye.